Okay, let's jump right in and talk about cortisol. This hormone is absolutely crucial for your body to function the way it's supposed to. Today, we're really going to zero in on identifying the clear signs that your cortisol levels might be elevated. Cortisol is undeniably essential for a vast array of biological processes. It's incredibly important for things like keeping your metabolism humming along smoothly, making sure your blood sugar stays nice and even, and keeping your blood pressure exactly where it needs to be. But honestly, it does way more than just those things. This hormone also has a major impact on how your body handles everyday stress. Cortisol even plays a role in keeping inflammation in check. Your body has this amazing, incredibly complex system that carefully regulates your cortisol levels, making sure they stay in that ideal range and don't fluctuate too high or too low. Now, when cortisol levels get out of balance, whether you have too much or too little, it can actually lead to some pretty significant health problems down the line. So, today, we're really going to focus on those specific warning signs that can suggest your cortisol levels are much higher than they should be. One of the most easily recognizable signs is a face that looks rounder and puffier than usual. You might notice increased fat buildup, especially around your cheeks. Doctors sometimes refer to this as plethora, but most people simply call it moon face. Besides just changes in your face, you might also see fat accumulating on your upper back, which can make your neck appear shorter and thicker than it normally is. This can then lead to truncal obesity, which is characterized by a noticeably enlarged belly, while your arms and legs become thinner and weaker. That's definitely something you want to keep a close eye on and be aware of. Another thing you should absolutely be on the lookout for is stretch marks. Elevated cortisol can cause a rapid increase in the appearance of these marks on your skin. This happens because your skin becomes thinner and more fragile as the layers underneath get damaged. These stretch marks commonly appear in areas that experience a lot of pressure, like your abdomen. They're also common during times of rapid weight gain or pregnancy. However, stretch marks caused by high cortisol tend to be more numerous, larger, sometimes almost an inch long, and a bright red or deep purple color. This is different from stretch marks linked to pregnancy, which are typically pink or silver. You might find these cortisol-related stretch marks on areas like your thighs, arms, or buttocks. The third sign you should be aware of is skin that looks noticeably thinner than usual. Another major sign of high cortisol is skin that becomes unusually thin, particularly on your elbows and knees. The skin might get so thin that you can actually see the blood vessels underneath, making it easy to tear or scratch, even with just a minor bump. This is often pretty obvious on the backs of your hands. For some people, the skin can tear incredibly easily, and even small bumps can turn into open wounds that take a long time to heal properly. Elevated cortisol messes with both the upper and lower layers of your skin, causing significant damage. As a result, the blood vessels under your skin become more visible, and your skin seems weaker and more prone to injury than normal. That's definitely not something you want to ignore or dismiss. A fourth sign to watch for is acanthosis nigricans. High cortisol can also lead to acanthosis nigricans, which makes your skin thick, velvety, and rough to the touch. This usually pops up in areas where your skin folds, like your neck, groin, and armpits. The skin in these areas turns a dark brown or grayish color, giving it a dull and sometimes even dirty look. While acanthosis nigricans can happen anywhere on your body, it often shows up as patches or blemishes on the skin. Basically, acanthosis nigricans is caused by problems with insulin, also known as insulin resistance. That's why you often see it in people with diabetes. As we mentioned earlier, healthy cortisol levels help keep blood sugar stable, preventing any dangerous highs and lows. The fifth sign to be aware of is sterile acne. High cortisol can cause acne to appear on your skin, and it's not your typical acne. Acne caused by high cortisol is different from the usual acne you might be used to. It appears suddenly, and the blemishes tend to be uniform in size and shape, which is a key difference. While regular acne can vary in size and might contain pus, sterile acne has a distinct appearance. It doesn't just show up on your face, it also spreads to your neck, chest, and back, which can be a real pain and make you feel self-conscious. Sterile acne is often caused by a type of yeast called malassezia. When cortisol levels are high, our immune system gets weaker, making us more susceptible to infections and causing acne on the skin. Sixth on our list is changes in hair growth. High cortisol can cause some worrying changes in your hair growth patterns, leading to increased hair loss, which can be really upsetting for some folks. Cortisol is produced in the adrenal glands, which also produce androgens, hormones that affect hair growth. The hair might get thinner and, in some cases, fall out completely, leading to androgenetic alopecia, which is a condition that causes pattern baldness. Of course, hair loss can also be hereditary, just like what your grandparents or parents experienced. Seventh is wounds that heal really slowly. High cortisol can slow down the healing process, causing even minor cuts to take longer to recover than you'd expect. As we mentioned before, cortisol is important for reducing inflammation in the body. You actually need some inflammation for wounds to heal properly. It helps protect the area from infection and helps the tissue repair itself. But when cortisol levels are too high, they mess up the natural inflammation process, which makes wounds heal more slowly. Usually, a small cut will heal pretty quickly, but when cortisol levels are high, that cut or wound will take much longer to heal, which can be both annoying and concerning, especially if you're prone to cuts or scrapes. Eighth, we have skin infections. High cortisol makes you more likely to develop skin infections, especially those caused by fungi and yeast. As we said earlier, high cortisol weakens our immune system, causing our bodies to react differently to the yeasts on our skin. This can lead to various skin problems, such as the sterile acne we talked about earlier, or other fungal infections like ringworm. All of these infections happen because the immune system is weakened due to elevated cortisol levels, making you more vulnerable to these kinds of problems. So, what exactly causes high cortisol levels in our bodies? There are lots of potential reasons. Certain medications can contribute to raising your cortisol levels. For example, some patients are prescribed glucocorticoids or steroids like prednisone or dexamethasone for various medical conditions. Taking too much of these drugs, or using them when you don't really need them, can significantly increase your cortisol levels. What happens if someone uses steroids in the form of topical creams? These creams or ointments are often used for skin infections or inflammatory conditions, and some of the drug can be absorbed into the skin. The amount that gets absorbed depends on things like your skin type, the type of cream or ointment, and how long you use it. But they can still cause symptoms of high cortisol, even when applied topically. It's important to remember that these skin symptoms can easily be mistaken for other conditions. So, if you're experiencing any of these problems, there's a good chance your cortisol levels are higher than they should be. Keeping stable cortisol levels is super important for your overall health and well-being. You can do this by exercising regularly, practicing relaxing yoga, staying calm and collected, and effectively managing stress and depression. Also, there are other changes you can make to your lifestyle and diet that we'll talk about in more detail in another video. Thanks for watching this video and checking out my channel. I hope you learned something valuable from it. If you found this video helpful, please give it a thumbs up to show your support and share it with your friends and family who might also benefit from this information. And if you haven't already, subscribe to the channel for more videos like this. Please subscribe now so you don't miss out on any future content. See you in the next video.